This Health and Wellbeing Board meeting, 12th of February 2026. We have three interesting items in this meeting. We are going to give end-of-era report on tackling inequalities, which you know is one of our visions, one of three county visions. Healthy Weight Alliance update, and then I think Jill has to say something about how we are going to organize agenda setting and streamline the processes of reporting and monitoring progress. So I would, before I start, I would like to tell you that I would request you that I would like this meeting to be discussion-oriented, suggestions, criticism, constructive, or even not so constructive. So because we are here to listen to you, listen to the partners, and then move on together as a team, because discussion suggestions are very, very important. So with that note, let me start the meeting with a usual warning that you are being video and audio taped, so your laptops, if it is open, may be seen by the cameras, so be aware of that one. Right, let's start the meeting, recording of the meeting. As usual, we will start by introducing ourselves to each other so that we can break some ice. I am Paul Ejid-Shelvan, Councillor for Clamlington South East. I chair this meeting.
Good morning, everybody. Graham Size. I'm a GP in ANIC. I am a clinical lead with Northumberland, North Cumbria ICB.
Okay. I'm Glenn Sanderson. I'm leader of the County Council. Good morning.
Morning, everyone. Jill O'Neill, Executive Director, Public Health and Communities at the Council.
Good morning. I'm Kamsari Chicken, Cabinet Member for Adult Services and Health.
Good morning. My name's Carl Green. I'm a councillor for Seaton with Spittal.
Morning, Marlon Smith, County Councillor for Eastfield, Cromlington.
Good morning, Abby Conway, Chief Exec of Citizens Advice Northumberland, representing the Voluntary Sector Commission Thriving Together.
Good morning, Rachel Mitchison, Director of Delivery for the North East North Cumbria Integrated Care Board.
Hi, Neil Bradley, Executive Director for Adult Services here at the Council.
Hi, good morning, Hugh McKendrick, Chair of Health Watch Northumberland.
Hello, Sharon Williams, representing Community Pharmacy North of Tyne.
Morning, John Caseley. I'm Chief Inspector for Communities for Northumberland Area Command.
Good morning, I'm Dr. Zakir Atcher. I'm Clinical Director and Consultant in Public Health for the Children's 0-19 Services from Harrogate District Foundation Trust.
Good morning, I'm Deborah Brown, Strategic Policy Risk and Performance Officer for Northumberland Fire and Rescue Service.
Hi, I'm Ross Wigham, Director from Northumbria Healthcare.
Good morning, I'm Karen McCabe. I'm a Senior Public Health Manager, Safe and Resilient Communities, and I'm presenting the inequalities item.
Andrea Todd-Clark.
So, the first item, apologies for absence, Andrea.
Chair, we have apologies from Lindsay McPhee, Hilary Porteous, Chloe Mann and Vicky McLeod.
Thank you. Shall we agree the minutes of previous meeting held on 22nd January 2026? Is that okay? Thank you.
Happy to agree.
Disclosure of members' interests. You heard the three topics we are going to discuss. Is there any disclosure of interest? None, I see. Thank you. So now we come to the first major item, addressing inequalities in Northumberland, and which, as I said, has been one of the three visions of the county, and we have been working on this short project for 3 years, and we are going to hear the end of the ERA report. I think I would ask Glenn Sanderson, who is also very keen on having this moving forward. So can you please introduce that topic, please?
Thank you very much, Chair. Good morning, everyone. It has always seemed to me morally wrong that a child born in one town in Northumberland compared to another child born in a town not very far away in Northumberland should not have the same opportunities and the same chance in life as each other. And that is always, that kind of has always seemed to me wrong and frustrating in that no matter how much people talked about it nationally, actually doing something about it was much harder, and something that actually a county council needs to pick up as a key priority. So when I became leader in 2021, we had our election, we found ourselves as the administration. I wanted to have 3 priorities, all different, all meaning different things, but actually all binding together as one. One is around value for money, to ensure that we do the very best we can for council taxpayers in terms of the services over and above what they would normally expect. To be very proactive and assertive and aggressive in finding new business opportunities and new jobs for people, and investing in the county to make it a throbbing heart of the North East. And the other third one is around inequalities and tackling inequalities and doing what we can to actually make a positive difference. They actually all bind together because throughout the life of a person in Northumberland, our services pick up all of those things that they are likely and need to connect with. That starts with childcare. It starts with the next step after that, with education. So we make sure that both childcare, and great that we get some government help with that, great that we have staff and support from our partners there. Education is something that's very important to us, and we know that our education service reached an outstanding verdict from Ofsted last year. Affordable housing, we are building more affordable housing. We will do more, and I'm very pleased and proud to say that our housing service, our council houses, has the highest level of satisfaction anywhere in the North East. And finally, around jobs, to get that confidence within someone who needs a hand, who maybe didn't like school and the school didn't like them, and they find themselves in this awful category of NEETs, which is just the most awful, term. We will provide, and we are providing through Northumberland Skills, a wide range of different opportunities for people to learn new skills. And I will never forget, and forgive me if I've said this already to you, when I went to visit a bricklaying class, and there were 4 or 5 young people there, and I said to them, you get this right, you will have a BMW by the time you're 21. And it's true. And I'm sure that some of them did do that, because whilst some people might think bricklaying is not a hugely exciting job, it actually is a very well-paid job, and it allows that step up the ladder, that confidence, that new start that people need. We have also invested £15 million in the Energy Central Learning Hub in Blyth, and we are investing more in Blyth to build on that. So it is around making sure that that skill is there. Equally important is the work that we do with our partners. I'm thinking particularly around Citizens Advice and others who are hugely important to us in providing that necessary care, that necessary support, that necessary help when needed, to provide the oomph that we need to continue with this work that we're doing. But, and this is a big but, how do we maintain the focus on this at a time when the council is busy with so many other things? Potholes, for example, the weather, for example, and all of those really key strategic decisions that we're making right across the county around new investment, whole range of things. How will we maintain the focus on this? Because it is a priority. It is one of only 3, and therefore it must and is remaining a priority and a focus. I have said I will pick up tackling inequalities within my portfolio of work. I don't have a lot, people will tell me, but this is one that I want to oversee. So I'm doing that. We will need to maintain that excellent relationship we have with our key partners, and we are doing that. And we are also very privileged to have set up, largely through Jill and her team, and Helen Patterson, our excellent Chief Executive, the Northumberland County Partnership. What is that, you may say? Well, it is a group of important organisations that cut across lives and work and opportunities right across the county. I'm going to tell you very briefly who's on that. And I could actually ask you that question and see if you got them all right. But I won't. So we have Advanced Northumberland, Age UK, Benistia. Actually, come on, let me, Neil, give me one name. Any others? Yes. 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 Yes?
Police.
Police. Yeah. So here's the list. Advanced Northumberland, Age UK, Benistia, people that let houses, the CBI, Citizens Advice, the NHS Trust, the Federation of Small Business, Health and Wellbeing Board, Home Group, who let houses, Carbon Homes, Newcastle University, North East and North Cumbria Integrated Care Board, the Chamber of Commerce, the Combined Authority, very key partner there, and I work very closely with the Mayor. Our political differences are fairly great, but we get on very well, and it is very important for Northumberland to deliver our 3 priorities that we get on well for the sake of NECA and the support it can give us across the county. Northumberland College, the County Council, of course, the National Park, the NHS Foundation Trust, Northumbria Police, Northumbria University, Port of Blythe, RAF Boomer, Tharsis, and have I mentioned the fire service, the fire and rescue service, and the fire and rescue service as well. Okay, so there you are. There is a big list of people. They're all really important organisations. The people at the top of those are very busy, important people, but they are continuing to work with us together to make a real difference, to make sure that we keep this momentum and this focus going. And it is a great privilege for me to have that going. And so finally, to conclude, the paper you have before you has all the details within it. The most important part of all, in my view, is the action plan at the end, which is on page 66. All the best reports have an action plan. All the ones that I'm never that keen on don't have, because you don't know how we're going to do it, how we're going to deliver it, when and who's going to do it. But this one does. So on page 66, there you are. There's the proof. There's the evidence that we are committed to this and everything that we do, and we will continue to be. Thank you.
Thank you, Councillor Sanderson. I think it was a very good introduction, passionately delivered. At some point, when I were asking questions of the audience, I couldn't help thinking that you'll make a very good university lecturer. Okay, so let me invite Karen McCabe to make the presentation, please. Thank you.
Lovely, thank you. Thank you for the introduction there. I'm delighted to be here to share this report with you today. The full report has been in the documents, and we have some paper copies there as well. So I'll just move into the slides, hopefully. Lovely. So I just wanted to start, and I'm not going to dwell on the past too long, but start with a little bit of context. I know that several people here today and the organisations that those people represent were involved from when this was a concept, before it was a report, and I know that some people in the room today have come to this new or have joined along the way. So I just wanted to do a little bit of background about the Inequalities Plan. It is a short-term leadership and culture change plan. It was developed in 2022 from an original inequality summit and 12 locality events that I know many people here today attended and contributed to. The purpose of the plan was to create the conditions needed for longer term change, so to start to shift us on our journey to that long term approach to addressing inequalities. The plan is called Bringing People, Place and Policy Together, and it is underpinned by evidence and good practice. At the outset, we linked and have continued to link with the evidence base and with some key people around that. We've linked with Cormac Russell around our asset-based community development, thinking about our people and our places. The work of Professor Chris Bentley around place-based approaches has really underpinned our thinking on place. And we are still currently working with the Institute of Health Equity, Professor Sir Michael Marmot's team, around those real policy drivers and strategic approaches to addressing inequalities. The plan was bold and it was ambitious. It was based around those 5 principles that you see there. It was about taking a community-centred approach, taking a strength-based approach, so focusing on what is strong, not what is wrong. We knew at the time, and we still know, that we have such positivity and resilience in our communities in Northumberland. So how do we work collectively to build on that? And how do we shift how we work together and shift how we work with our communities to take this forward? Picking up on Councillor Sanderson's point, there was a specific action plan within the inequalities plan. There were 23 short-term enabling actions based across 5 themes, delivery based across 5 themes. And these were underpinned by the building blocks of a good life, those real structural and key elements that need to be in place to enable our residents to thrive. The report details the progress on these actions in section 3. When I was pulling the slides together, I thought I'll just pick a couple out to highlight. And I started and found I had 23 things that I wanted to talk about. So I went, I'll narrow that down, and I went, I can't. So I'm just asking you to look at it. There is some amazing work detailed there that we have collectively taken forward as a system in Northumberland. Some of the work is fully formed and complete and embedded as business as usual. Some of that work, because work around inequalities, again, as Councillor Sanderson has said, is not something that happens overnight. This is a long game. So some of that work is underway, and some of that work is still at the early stages, 3 years in, because it takes a lot to get some things moving and started and the right people around the tables. So as I say, there was too many for me to discuss, so I'll let you browse that at your leisure. Also within there, section 6, we have some case studies, some amazing case studies of work that has been taken forward by partners. The case studies are in a separate section because we recognise that we wanted to be able to demonstrate the work that we had taken forward in relation to the action plan. But much of the work that is taken forward is cross-cutting. So how did we capture that, and how were we able to get those pieces of work that cut across all of the themes or multiple themes within the final report? So we've put those in as some case studies at the back. And I also just want to say, this is a snapshot. This gives you an idea of some of the work that we're taking forward. We could never be able to capture any of that conclusively together. So as well as taking forward those short-term enabling actions to help us to set the context for going forward, we also wanted to strengthen and build the collaborations and commitment that was really rich at that time, and we wanted to just develop that further and create a social movement for change. Some of those key drivers there have been yourselves as the Health and Wellbeing Board, who are advocates and leaders for this plan. As Councillor Sanderson has said, we have inequalities as a priority within the corporate plan. Our Thriving Together, working with communities, looking at our voluntary and community sector partners, not only as delivery partners, but as equal partners in our decision making. And we really wanted to take that forward. The plan has had support and steer and challenge from some critical friends along the way. At the very outset, we had an inequality steering group, and again, members in the audience have been part of that. The county partnership came into play roughly a year into the plan, and that inequality steering group stepped back, mainly, not because there was nothing to drive forward, but mainly because that driving force, those same people were represented on the partnership. All the way through, we've had a Thriving Together voluntary and community sector task force, and we've had a cross-political party working group as well, to give us steer and challenge and to help us develop the longevity and the sustainability of the plan. The diagram on the right-hand side, I think it's the right-hand side of the slide, shows some of the events that we've held. Those events have been where we have really developed our social movement and kept the momentum going around our plan, keeping the energy going. We've been able to bring together topic experts and key stakeholders, and most importantly, those with lived experience, so that we know as we're developing the actions and progressing with the work set out in that action plan, that we have been able to keep it real for the people in Northumberland. The county partnership, I could have put this slide on and helped you with the quiz at the beginning there. The county partnership, as Councillor Sanderson has discussed, was formed around about a year into the plan, and this was formed. We know that the drivers of inequality are deep-rooted and multifaceted, and we need a whole system approach to be able to take that forward. If we needed to achieve meaningful change, we needed to have broader collaboration beyond the usual suspects and the willing group of us who will always address inequalities and see it as a priority. So as I say, 1 year in, the county partnership was formed. The partnership have committed to take forward that 20-year mission to reduce the gap in experiences our residents have across health, education, employment and social outcomes. The partnership is leading on 3 key areas of work at the moment. They are leading the work that we are doing at the moment. We have 3 deep dives with the Institute of Health Equity, and they are supporting us to look at addressing inequalities linked back to the Marmot principles, addressing inequalities around housing, around employment, and around best start in life. The partnership also oversees the collaboration that we have with academic colleagues at Insights North East. That is the development and production of our Northumberland experiences, which is our social change and lived experience portal to look at what living in Northumberland is really like, and how, as we move forward over that 20-year period, that may be beginning to change. So that is coming together as well. And then, as our anchor institutions, those organisations that are set out there, it is that having that collective approach, that rooted in Northumberland, the value of the action by those organisations independently and as a collective to take forward a commitment around inequalities, to really look at how they can make a difference. And those partners are taking forward their local employer commitment, and they're taking forward work around procurement and commissioning to really look at the value of our Northumberland pound. Excuse me a second. So that's a really whistle-stop tour of a lot of what we've done over the 3-year period. How do we maintain this and grow this going forward? Because that is the key thing for me. I'm really, really proud of what we've achieved as a system, but how do we take it forward? The Inequalities Plan laid the foundations. As I say, it was a culture change and a leadership change to get us thinking differently around our approach to inequalities. And as you can see there, there's a long list now of local strategies, policies and plans, all of which have inequalities as a core part of their being. Inequalities is no longer an add-on. It's not something you do as well. It's something that is central to the way all of us work. This also resonates with things that are happening nationally. We know that in our 10-year plan, the NHS 10-year plan, that neighbourhood health is a key element of going forward. So again, thinking about that people and place-based approach. We have, over the past 3 years, developed better ways of sharing data and intelligence together, and we're in the early days of development of a system-wide intelligence strategy, which will help to underpin our actions and our decision-making as we go forward. There has been work around our joint strategic needs and assets assessment, and there you will see also our refreshed joint and health and wellbeing strategy. It was refreshed in 2023, and within there are closing the gap indicators around inequalities. So that gives us our sense check for our tactical and operational delivery going forward. I've mentioned the 3 deep dives that we're taking forward with Institute of Health Equity. They're coming to a close, and there is a development session looking at those Marmot principles and what has been pulled together in Northumberland, a development session for the county partnership in May. That is a chance for the county partnership to take stock, to look at the recommendations, and to plan how we want to take this forward strategically. I'm hoping they're big enough there, and I know you have copies of them in the report that you have. In pulling the report together, we wanted to, we collate all the information, but we wanted to understand if this really did reflect how people felt and whether this was really meaningful. So we contacted a number of key stakeholders, many of whom had been on the initial inequalities steering group, and we asked 3 questions. The first of those questions, we asked if there was any change or shift in culture that they felt was noticeable over the 3-year period. And there's quotes up there from Neil and Abby here today. And for me, some of the key things that come out in those quotes are the level of buy-in, that concept of genuine change, collaboration, and that things are embedded as everyday business as usual, day to day, going forward. The second question that we asked was whether or not there had been any influence in leadership and strength-based working. And we have quotes from Kevin from the police and from Helen from Fire and Rescue there. And those quotes, again, really resonated with me. It talks about strengths, resilience, local voices being present in decision-making, and inequalities being built into future leadership planning, which felt really, really positive for me. And so that's why I included these particular quotes. So that brings us to the future. How do we take this forward? How do we move forward? The quotes up there are smaller and it may be harder to read. Quotes from Derry from Health Watch and Graham, yourself, as Vice Chair. The quotes there say that there's still a lot to do. We've done a phenomenal amount, but there's still much to do. We can't sit still. We need to take this forward and remember that this is not just a statutory sector area of work. Inequalities is everybody's business. We need to be able to do that. We need to broaden our reach and engagement and be able to bring more partners on board. We also don't need to get caught up in the process. We need to be able to develop those relationships and really build on the values that we have at the moment and want to take forward. And the county partnership is absolutely key in being able to do that. So going forward, and my recommendations, my ask of yourselves today as the board, is to have some thought and see if you feel that the inequalities plan has fulfilled its original short-term function as a catalyst to change. There's an ask to yourselves as partners and organisations to continue to embed and live and breathe those principles of the inequalities plan in both your strategic direction and as business as usual, and to recognise the role of the county partnership in taking this forward over the 20-year mission, embedding this and embedding inequalities more widely as business as usual. And the ask there is that Health and Wellbeing Board receive reports and updates from the county partnership. And thank you.
Thank you very much, Karen. Thank you very much. Are there questions, suggestions to, because there are 2 parts to it. We have a report You can ask questions on that. And then there is also a question how we are going to sustain going forward. So we are open to your suggestions. Yeah.
I'll set us off, Chair.
Sure.
Thank you very much, Karen. I know how much you've put into this, having worked with you personally on this, so that's just personal thanks. Thank you very much. And then to everybody else that's been involved in this. One of my thoughts with this is that I can remember Glenn, actually, at one stage, we set off with this thing about health inequalities. And Glenn very rightly said it's not health inequalities, Graham, it's inequalities. And I think he set us up nicely at the beginning with that.
I'm sorry.
No, that's right. And actually, that's something I've continued to have to keep in my mind throughout, because health inequalities is actually a very different thing. And health needs to play into this. And I am conscious that we are, again, in the middle of a reorganisation of how we go about our health organisations and the more strategic view of that. And I would just be looking, I think Ross is in the room, and I would really look to you, Ross, and say, I know there are some emerging changes in how things might work. And actually this set of core values which we have developed is really important to take into that new way that the organisations are going to relate to each other across Northumberland, because it's going to change a little bit. And I think it's probably here, please take this into that as well. But then it's not just you, obviously, it's everybody in the room. And the other thing, I know Abby's put a hand up, and my other point was, I think, within that system, we really need to work on that parity of esteem of the VCSE sector, another sector in that planning, because that's something that we've worked hard on, but are still not there, I'm sure, and you will have a view on that, so thank you.
Yeah, thank you very much for that report. It is really great to see it all and to encapsulate.
Ross, I will call Ross to answer that, and then I'll come to you. Yeah.
Thanks, Chair. And just a sort of a reflection rather than a kind of comeback on it. I think that's absolutely right. And we seem to be in this endless cycle of reorganisation and a lot of it beyond our control. But one thing that does hearten me a lot is that we talk about these same issues within our organisation as well, and work with partners through our Health Inequalities Board within the Trust, which is led by Dr Blair, who sometimes comes to these meetings as well. Again, we've got some real evidence of improvement and how we are kind of reforming those services to meet health inequalities, which health probably hasn't always been at the forefront of. It's, you know, free at the point of service, and we kind of just roll along like that. But we uncovered a lot of health inequalities after COVID, and have done quite a lot of work to tackle that. So I think as we move into this kind of new phase, we're really well placed to tackle some of these issues, and it's great that, you know, we're one of the partners as well in that group. So I think it is one that everybody's set on, and we're all kind of working together to hopefully solve that. And the changes will give us more power, I think, to act locally in the way that we think, hopefully some more money around that as well. So I see it as a real opportunity rather than a challenge to the health inequalities piece.
Abby?
Thanks. Yeah, I think it was just what this work has demonstrated is that it isn't just about health inequalities, but actually inequalities are played out in every single sector and with all of the partners in the room, and actually that's what we're all attempting to tackle. And I think, you know, obviously with the culmination of the plan, certainly from a voluntary sector perspective, we've started to coalesce around things like the Integrated Health Organisation and Community Health and the ICB, as well as the Health and Wellbeing Board. So as a sector, we're going to innovate into a health and voluntary sector network, which is going to look at those 4 key things so that more and more partners can start to feed into these conversations around the agenda and the work plan, as well as everything else that's kind of happening. Because as we transition to do more things in communities, it's really important that the communities that are represented through those voluntary sector organisations. Thanks.
Any more? Yes, please, Rachel. Thank you.
Hi, thank you. Really, really good to hear all of that and go back on that journey. And it is set a really good legacy. And I hear people saying, we need to look at this in a inequalities lens, which I think, oh, that's amazing. And the what can communities do for themselves? I do hear that through our commissioning organisation when we're looking at new pathways, which is a really different way of looking at it. And we are now waiting, we're always waiting for some guidance or other, but we're waiting for sort of neighbourhood health guidance and what will that look like. And I think this has set a really good foundation for how we will do that, but do that in a different way. And even questions like, is this just health? Or is it health care? And people immediately thinking wider. So I think it's been an excellent piece of work and has absolutely set a brilliant foundation, certainly for how we would move forward as commissioning healthcare services.
Yes, please, Jill. Yeah.
Thanks, Chair. Just to echo what Graham said about thanking Karen and everyone else for all of the work that we've done. It's a really trite saying, but it's true that strategy and paper don't create what we've created. This is about absolutely trusted relationships and coming together to have that common core mission. And you can't always quantify that, can you? So it's quite tricky when you come to the end of an action plan and people want the hard outcomes, but that in itself is a fantastic outcome for us, that 3 years in we're even more mature than we were, which is what we set out to achieve, and the fact that we've all committed to that 20-year ambition towards 2044. And also the political leadership isn't taken for granted, because this goes beyond the political cycles. So having that cross-party buy-in with the leadership of yourself, Glenn, is fantastic for us. And the risk that we've taken to flip it to assets and strengths as well, rather than to always focus on the deficit and always focus on what's wrong. That's a very different narrative, but that came out incredibly strongly when we went out to the localities to have conversations, because that sense of pride is there in our communities, but it's also there as us, as stakeholders and as partners. We are proud of what we do, but we also know that we need to do more, which is back to the point that you made at the beginning, Glenn, around 2 children should be able to grow up and have equity in opportunity and equity in access to live the best possible lives for themselves. So it's been a huge 3 years, and I don't know if I won't be here in 2044, but I'll hopefully be alive, but but we need to keep that going and pass on the legacy. We've got new partners here, and we just need to keep on that message, because it can't just stay with the few that were part of the beginning. So it's great to have this report, and looking forward to the next steps. So thank you.
Can we focus a little bit on, I mean, we have got these commitments, like sustaining system commitment for generational change. We have got something. I was thinking about these things. I mean, it still has the health baggage, which is inevitable, because we started off with health inequality and then moved on to the gender inequality. And like, for example, I was thinking, I'm just airing this idea without meaning to offend anybody. Like, over the past 8 years, we have increased the standards of the schools, particularly in primary schools. Our Ofsted reports are very good. But still, I believe there will be attainment gaps within the children's school, right? Can we look at that from an inequality lens? There is a gap. How much is due to inequality? So I'm just pushing the boundary a little bit far away from health. Of course, I'm not saying health is anyway unimportant, absolutely not. Can we look at that, for example? Why this attainment gap exists? How much is related to inequalities? Is there anything they can do? Again, coming back to the fundamental principles, is there anything we can do and we can help them to do themselves? So we need to be also thinking further down in the field. You know, inequality is not restricted to what we have done in 3 years, which is fantastic. Again, I don't mean to mean anything else. So it's something we need to be thinking about. Where are the areas? You know, I just came with this educational attainment gaps. Can that be? Because for me, education is a very important thing, which is going to address inequality throughout the life, for example. Especially we are in the information age, and the fundamentals, they learn in the school are going to decide their future, right? And so it's very important we focus on that one. I think it's a source, it can be, how can I phrase it? It can be a potential source of inequality injector. It injects, two children who had a very good primary education and not so good primary education, they are more likely to completely differ. So the inequality kind of gets enhanced over time or in their lives. So if we address at the point of origin, primary school children, so that would be another step forward to think about. I'm just dumping the ideas for discussion, yeah.
Just to confirm that our third deep dive area with the Institute of Health Equity is Best Start in Life, and we're specifically looking at attainment gap and the good level of development, because we've been set the target nationally. I think it's 70% nationally, but when you look below the Northumberland County Council level, we do have significant variation. So we're absolutely looking at that, and that will come into Health and Wellbeing Board as we work towards our recommendations. So absolutely right, Chair, we are prioritising that.
Again, as Kiracha, representing the 0 to 19 service, and I think just reinforcing, as Jill has said, I think there is a real focus around particularly almost the prevention side. So school readiness is a big focus for us as part of the NHS 10-year plan. And also working with partnerships in Northumberland around what are the mechanisms for assessment, what are the interventions that are important for those young people, the children particularly, before they start school, that will impact on how ready they are to actually make the maximum use of education when they start. And the local staff that are working across Northumberland are an integral part of that assessment and intervention.
Neil, please.
Yeah, just from a slightly different angle and an observation about kind of how to make this real as well. I mean, I think we've had a lot of success over the last 2 to 3 years here in Northumberland because we've had a very senior person who is the hook for this. I mean, we can have a great plan, we can meet intermittently to talk about housing and employment and other issues and pull that together, but they're pockets of work. The question is, how does it live constantly in the psyche of a large public sector organisation? And I have to say, I think our hook is Jill. I mean, we've sat through budget planning meetings recently. We've sat through meetings about significant strategic change. And it's almost a bit of a social conscience on the side when Jill will pipe up and say, hang on a second, can we just think about health inequalities here and drive that into the discussion, which then seeps it into the culture of the organisation. And I can feel myself saying it now in my management meetings and things like that. I mean, hopefully all partners kind of have that hook and that catalyst and they're permeating it through the organisation. But if they don't, I would just encourage have a think about that. Does one person, and it is Jill in our area who's took the lead role for that and has been almost the irritation at points in time. And I don't mean that in a negative way, Jill. I mean it in a really positive way. Agitator is a better word, perhaps. Agitator, to make sure that we're constantly coming back to that. But it gets lost, in the chaos of needing to find large-scale budget cuts, in the chaos of desperately trying to drive through an agenda because we're being criticised for something or whatever. It is just that pushback all the time. And that moves it away from just a plan that we intermittently come back once every 3 months and have a bit of a conversation about or whatever, to us living and breathing it as an organisation. And I think the council's pretty damn close to that in most areas where we are living it now. So I'd just encourage others to have a little look at that and think, who's your hook in your organisation, who is in everybody's ear all the time at a senior level, making sure you're just thinking about this in the major decisions that you're making. Thank you.
Right. Any other comments, suggestions? Okay, thank you very much all. Thank you especially to Karen for having made such a good presentation. So shall we all agree on the report and the recommendations? Yeah, thank you. The next item is Healthy Weight Alliance annual update. I think this will be introduced by Councillor Eve Chicken.
Thank you, Chair. I'm really pleased to be introducing this today because it's something that a sector that I work in my day job. So it's something I see the effects of it, see the benefits of it every day. So healthy weight is exactly what it says on the tin. It's from seal. It is healthy. It's not about being skinny. It's not about vanity. It's not about body positivity. It's about health, purely and simply health. That healthy weight affects our lives right from the very beginning. A good start in life with a good healthy weight most often continues throughout that person's life. There are, of course, other factors that can sometimes affect, for example, certain health conditions which make it much harder and sometimes, frankly, impossible to keep that healthy weight, but most people do their level best. Your weight, your health is entirely your responsibility, but we're not blind as an organisation to the fact that there are multiple factors that draw into that. It's been mentioned a few times already this morning about inequality. If you don't have a stable home, you can't focus on your health, you can't focus on your weight. If you are miles away from a supermarket where you can buy very cheap fruit and vegetables, you can't concentrate on your healthy weight. I'm really pleased that at Northumberland County Council we spend a lot of time, money and effort on building all of those partnerships along with our partners to make sure that we have the best start and the best focus on that at every point in somebody's life. We've spoken recently in the last few months in these meetings about the importance of health, healthy weight, healthy exercise for people with dementia, preventing dementia, those living with dementia. There are many factors that come into this. We have some of the best leisure centres in the country. We have so many leisure centres that provide a whole range of activities for people with varying abilities and also varying costs. If you are far away from somewhere safe that you can exercise and keep on top of your weight, you are going to struggle. If you don't have green and open spaces that are completely free to walk, to exercise, to do what you do in order to maintain a healthy body weight, that will simply suffer. We really pride ourselves at Northumberland County Council on delivering those packages of leisure centres, green and open spaces, travel corridors for cycling, which are not just for mammals. If anybody doesn't know what a mammal is, that's a middle-aged man in lycra. They are for everybody, your very beginner, your children, your teenagers, anybody who wants to get to college, wants to get to work. Introducing those and making sure that they are in a good quality is something that we really pride ourselves on. This is now in its second year, so we're going to get an update on exactly how this is progressing and how we intend for it to progress in the future. But a healthy weight leads to a healthy life, and a healthy life is a productive and long-lived life. Thank you.
Thank you. May I invite our Public Health Manager, David Turnbull, to put the presentation.
Thanks for the introduction, Councillor Chicken. As Karen's just said, although she's left, it was a privilege for Karen to introduce the previous item. It's a privilege for me to sit here as part of the Healthy Weight Alliance and provide you with the second annual update from the Healthy Weight Alliance. So just a little bit of background and context with regards to the Healthy Weight Alliance. So it was established in 2024, and this was following recommendation from the Director of Public Health's annual report. So this was Liz Morgan's final outgoing annual report, which was based on healthy weight for all children. The Healthy Weight Alliance has the goal of turning the tide towards healthy weight, acknowledging that this will take time, as Karen's already mentioned, with any inequality. It's unlikely that we're going to be able to snap our fingers and do things overnight. It acknowledges that it will take time. Over the past 3 decades, unfortunately, levels of unhealthy weight have been on the rise, so this is something that will take time to turn that tide, although we are confident that we can do that. The Alliance reflects and acknowledges the long-term system-wide approach needed to make healthy weight everybody's business. Again, obesity and overweight, or unhealthy weight, as we tend to use. Forgive us if the language and the terminology does flip. It's a complex, multifaceted issue that will, it's unlikely that an individual organisation and individual intervention will turn that tide. It's a collective approach that is needed. And there is strong agency representation and collaboration within the Alliance. The leader has gone, unfortunately. There was an opportunity to play Healthy Weight Alliance bingo. I was going to name some of the organisations that are on the Alliance. There are currently over 40 members of the Alliance. Now, that in itself doesn't really mean anything. Of those 45 could attend. The Alliance is a very well-attended Alliance. There are lots of people in the audience today who attend and contribute. We have a whole range of NCC services. We have primary care, we have leisure in there. We've got charities, we've got citizens' advice, and we've got various healthcare trusts on board on the Alliance, all contributing, all playing their part. So the purpose of the second annual update of the Alliance is to provide board members with an update on progress made in the initial year one. Just to go over a couple of those, they included the development of an assessment tool to prioritise Healthy Weight Alliance actions. It was to ensure that Healthy Weight Alliance members had access to data regarding healthy weight to inform actions and address inequalities. And it was to ensure that the Healthy Weight Alliance responded to any national policy consultations that came out. And I'm pleased to say that all of those actions in year one, and that is only a few of them, have been achieved or are being very well progressed currently. So just with regards to healthy weight and health promoting environments, just want to outline how important healthy weight, I think we all already know, but just with regards to healthy weight and health promoting environments and the multiple benefits of both of those things, it's well documented. There is strong evidence around being a healthy weight reduces the risk of long-term mental and physical conditions. There are broader benefits. There are lots of broader benefits, in fact, than just health alone. However, and these span across social, educational and economic benefits. We know that healthy weight plays a role in reducing social isolation. We know that it has improved in attainment amongst our children and young people. And from an economic perspective, it increases productivity at work, as well as reducing the likelihood of employees having to retire early. There are benefits across the life course, regardless of age. However, it's incredibly important that we focus on children and young people who have a good start in life, the best start in life, and who start life on a healthy weight trajectory are more likely to follow that trajectory all the way through their adult life. In terms of health promoting environments, we know that health promoting environments can lead to healthier and more productive communities, and we know that aligned action to promote healthy weight environments have multiple benefits across multiple agendas. So creating environments that promote healthy weight are also likely to see reductions in traffic, reductions in litter, support efforts to address climate change, as well as improve access to parks and green spaces. So what does the picture of healthy weight look like in Northumberland? Again, as I outlined last year, the good news is that still most children and young people are of a healthy weight. However, unfortunately, there is a gradual rising trend in both reception and year 6 rates of overweight and obesity. A significant proportion of children of healthy weight and reception are unfortunately overweight or obese by year 6. These are the 2 touch points that are measured by our National Childhood Measurement Programme, by the way, hence the reason why we always mention reception in year 6. In addition to this, as I'll show you in the next 2 slides on the chart and then on the graph, as has already been outlined today, the burden of unhealthy weight doesn't fall equally amongst our children and young people population. In terms of our adult population, again, unfortunately now 2/3 of adults are estimated to be overweight or living with obesity in Northumberland, making obesity and overweight the social norm. So here we have a relatively complex graph. I'm not a data analyst. Data is not, Jill will tell you, data is not my strong point, but we've got cohort data, so we are tracking the same group of children from what is the left-hand side of the chart across to the right. So you'll see that we have 4 coloured blocks representing underweight, healthy weight, overweight and very overweight. For reception age children on the left-hand side, and then year 6 children, that's your final year of primary school on the right-hand side. So the bit in the middle where you can see that almost the flow in the percentages is showing how children track across those weight categories as they progress through primary school. And to summarise, unfortunately, we see a greater proportion of children in the overweight and very overweight categories and fewer children in the healthy weight category when we track cohort data from reception across the year 6. As I mentioned before, unfortunately, the burden doesn't fall equally across all children and young people. In this chart demonstrates IMD deciles from 1 to 10, 1 being the most deprived and 10 being the least. And you can see there that a child growing up in IMD 1 is almost 3 or 4 times more likely to be very overweight than a child born in IMD decile 10. We know some of the reasons behind this. Some of the reasons are behind the proliferation of fast food outlets within more deprived areas as opposed to more affluent areas. We see lower levels of physical activity in more deprived areas, again, as opposed to more affluent areas. And affordability of healthy food compared to convenience foods often on offer billed as cheap, quick foods is another cause. Thankfully, we are getting a lot of support with regards to promoting healthy weight from a national perspective. Last year outlined 4 or 5 of the key national policies that we're seeing coming through. Most are now in play, and we have seen a continuation of those policies this year. Some again which are currently in place, some of which are in consultation, which we've commented on, and some of which are future proposals. First, we've got the high caffeine energy drink sales to children under the age of 16. There is currently a consultation out proposed to ban high caffeine energy drinks to children under the age of 16. Often these drinks are low in nutritional value and high in sugar content, not only adding to children's weight status and adults' weight status, but also having negative effects on emotional health and also on oral health. We have the advertisement of food and drinks high in fat, sugar and salt. Unfortunately, this was paused last year but has now come into play in January 2026, banning the advertisement of foods high in fat, sugar and salt to children and young people between the hours of 5 AM and 9 PM, where we know our children and young people are most likely to watch TV or be online. And we have a reformulation of the soft drinks industry levy, which is being updated, which will lower the current soft drinks industry levy sugar from 5 grams to 4.5 grams, and also increase the number of products that will fall under the levy, including milk-based products. This will follow on from the initial soft drinks industry levy that came in 2026, which has seen obesity rates not rise as rapidly as what they potentially could have done, and also a reduction in the number of dental cavities and tooth decay. Oops. So it's great that we talk about national policy. What does that mean at a local level? And the two are absolutely interlinked. So in terms of local action to support healthy weight, some of the actions that have been taken as part of the Healthy Weight Alliance are outlined in the paper as attached. I just want to go over some of those relatively briefly. 2 years ago, the local authority, along with all other local authorities in the North East, signed up to a Good Food Local benchmarking exercise, which looked at improving all food under the control of councils. We submitted our portfolio of evidence, our portfolio of work, and received a series of recommendations on how to get even better. Those recommendations now feature in Northumberland's food strategy, which will be coming to Cabinet late spring. We have the prevention of unhealthy advertising. So a colleague within public health has gone out and assessed the current advertising space that is available for unhealthy advertising, and we are looking at progressing that into a potential unhealthy advertising policy. The Trust's worked really hard on addressing weight stigma. They now have a weight stigma checklist, accredited training and an interactive patient tool which is designed to have a compassionate conversation around improving healthy weight and how people can go facilitate more exercise opportunities and eat better. We have enhancement and interventions already happening, so our family hubs are doing some great work around the Henry programme. They've expanded their programme and now have additional programmes about eating well for less and eating healthy for fussy eaters. And Northumberland's physical activity strategy is currently in development, and that will recognise the role regular physical activity can play in maintaining and achieving and maintaining a healthy weight. Just as we've mentioned, having to change the food environment, we must also change the physical activity environment. So the next steps for the Healthy Weight Alliance, the leader's already outlined. Every good alliance strategy has an action plan. I'm glad he's not here. We currently don't have one. However, based on a piece of work that we've done around assessing the strength and the value of the Healthy Weight Alliance, feedback was that the Healthy Weight Alliance give partners a coherent approach, could pool resources, but one of the items that partners felt was missing was a hardened action plan. Who's going to do what, when, and who's going to take the responsibility? At the next Alliance, we are going to table our framework for creating a Healthy Weight Alliance action plan. We are looking to pilot some of our place-based approaches to address healthy weight, bringing partners together to focus on concentrated areas. So that includes some of our work that we'll be doing, focusing on children and young people around school super zones. We are going to continue to progress actions against the commitments outlined in both the local authority and the Healthcare Trust's declaration on healthy weight. We've started having conversations and are now well into those actions or conversations around what the food environment in hospital settings and local authority settings could look like, and have made good headway on things like vending provision. And we are going to ensure that the Healthy Weight Alliance input into the new local plan to ensure that planning policies influence how we move and the food environment are issued within the next iteration of the local plan. And it's great to see that we have various members of the planning team sitting on the Healthy Weight Alliance. So the paper asks or notes that the Health and Wellbeing Board should note the content of this update and continue to link in all parts of the system to ensure a complete response to issues around healthy weight. It asks the board to reflect on the update, keeping the system linked in to provide a thorough and joined-up response to healthy weight issues. And it asks the board to ensure that Healthy Weight Alliance actions align with system-wide priorities across all Northumberland partners. Thank you.
Thank you very much for the good report, update actually. It has been running for 2 years, is it? Yeah, thank you. I thought so. Are there questions to Mr. Turnbull? Suggestions? Yes, Alan, please.
Yeah, thank you for that presentation. It was quite informative. Couple of points I would make is that, to be honest, some health professionals don't exactly set a good example themselves in terms of healthy weight and lifestyle, etc. I think that needs to be taken into account. The other thing was, when you were having this campaign about a healthy weight, that to me takes away the sort of stigma. I'm also looking at the people who develop anorexia as a result of this. Yes, obesity, as you pointed out there, that's the bigger problem. But some people say, oh, healthy weight, and then they start this whole diet of continuous destructive dieting, etc. But that's much less of a problem from what you're saying than obesity.
Yeah, absolutely. As you'll see from the children and young people's diagram that we put up, and then also the adults data that we've got around those who are underweight. Thankfully, those with what we class as an eating disorder are generally under good medical supervision. I think, again, we've got to always bring things back to the role of the Healthy Weight Alliance. Our role is around prevention, not necessarily diet management or healthcare support. So, yeah, it's a difficult question. Probably one that the medics potentially, looking at yourself, Graham, may be better to answer. But what we've got to ensure that is for future generations, eating healthy is the most affordable, accessible, and first choice. That includes fruits and vegetables, stable carbohydrates, and try and prevent against what you're classing as sort of yo-yo dieting.
Any response from you?
So my first response is I was a bit distracted because I was trying to think about what I just heard about health professionals having a greater responsibility to model good behaviour around weight, which I think is what you're saying. And I think it's very difficult to start casting thoughts about who has the greatest responsibility to exhibit healthy weight. And I think it's everybody's responsibility, really. And I think it's a very dangerous place to start saying, well, actually, it's a health problem, and therefore there shouldn't be any obesity in people who work in health, because that's a bad example. So I just want to challenge that a little bit, because I don't think it's necessarily the right thing to say. I did notice in here you've got a bit about weight loss drugs, and that it's not really in scope, and yet I think it is really important, and I went back to it just now to check you've got it in there. I could almost certainly say that the average weight of obese people in my practice has reduced over the last year, and I could almost certainly say the majority of those people who've achieved really good weight loss are buying the drugs privately, and that's not sustainable, although they will become cheaper in the future. However, it's a pharmaceutically led problem, much like it is with alcohol, you know. So, and I think we just have to think about where our strategies sit on that carefully. But I really get the prevention side of things. Going back to your question, just explain that one again for me, and then I can come back on you on that.
So those who've got eating disorders, I think, is the gentleman's question.
Yeah.
Not, my point is not necessarily the primary role of the Healthy Weight Alliance, probably an issue that is better situated within healthcare.
I think eating disorders are such a specialised part of what happens to young people that we have to be careful not to group it together and make sure, I think from a CNTW perspective and Best Start in Life and everything else, I think we need to keep that in its place really, because it needs a very different approach, I would say.
Yeah.
Yeah.
I think what I see from the graph is that the underweight basically stands still, isn't it? From the reception to the year 6.
There are a small number.
Very small, and I think Alan's question is, if you are focusing too much on obesity, will you end up aggravating anorexia, that eating disorder? I think, in all honesty, as I see, it is a possibility, but I think it needs to be handled very, very sensitively. Yeah, we don't want to encourage a person who's having this eating disorder to be obsessed with excess weight. So that, yeah, go on.
Moving on from that, I think that's a good point. I was thinking about policies, and I was thinking about the policy around supermarkets not having high sugar things just on hand for impulse buying. Mm-hmm. Recent experiences in service stations suggest that they are a real hotspot for people being tempted into buying high sugar items, because it's like running the gauntlet of gladiators as you try to get to the till in most service stations these days. And I just wondered if there was any viewpoint on other outlets like that we can influence.
I think this is where the place-based approach will work really well. So there's a couple of things that I would say, Graham. And one is that the policy has its flaws. So the policy around impulse buying, so buy one get one free multi-buy offers, is designed very much for supermarkets, as you've outlined. There is a square meterage, and I can't remember it off the top of my head, so I won't try and guess, which probably gets service stations out of that policy, i.e. they are allowed to put things on the end of aisles in front of your face when you're coming to buying products. For me, I think it comes down to our relationship with local businesses, and if service stations are in that remit, then potentially we could work with service stations to look at things like shop floor layout, making sure that they are putting healthy items in front of people where we know they're most likely to make impulse purchases, but also that we can demonstrate, and this is quite important to local businesses, that they won't see a financial downturn because we are moving things around. But I think that local, you know, a bit like what we're going to attempt to do with the school super zones, why couldn't we do that with, you know, a range of businesses, service stations, convenience stores, all likely to fall within the same bracket. And it's about having a relationship with local shop owners, convenience store owners, and again, going back and convincing them that obesity or healthy weight is everybody's business and they are part of that problem and therefore can be part of the solution.
Yeah. Yeah, please.
Thank you. Thanks, David. Really good presentation. I think this is always one of the most complex areas for the public's health for us to consider. It's not as straightforward as tobacco when we had our annual report coming in, and look how hard we've had to battle in relation to that. And it's a much more binary argument, isn't it, that just don't smoke and tobacco's bad. And then alcohol is quite nuanced, but then we get to food and physical activity and that societal impact. So I think it's a real challenge for the Healthy Weight Alliance to look at what the actions actually are. So just reflecting on some of the conversation that's happened here, it is about that population level shift for us rather than individual treatment aspects. So that up till now, that's why there hasn't been the focus on the medical model and the treatment side of it as such. But actually, when we talk about the number of people, an increasing number of people that are taking weight loss drugs, and we know that the license is only there for a couple of years, and then what? We know the evidence is that people are likely to put weight back on. That then becomes a role of the Healthy Weight Alliance to create the environment so that actually during the period of time that people are on weight loss drugs, ideally they are developing different relationship with food, they're developing a different relationship around physical activity, and have got an opportunity during the time of being on the medication to hopefully switch some of their way of living their lives pending on the circumstances that they've got. So I do feel that that is a role of the Healthy Weight Alliance to continue that environmental change. That is also the slower burn change for us to take into consideration. And also I think it's still really very much in our faces that at the point at which we've got 2/3 of the adult population overweight, then that will cover all professions, whether that be a health profession, whether that be policing profession, whether that be working in the planning department or wherever in a local authority. So it becomes, again, that societal issue. And it's how we have an ability to reduce the stigma, whether that's for people who are underweight, because there's a huge amount of stigma for people who are underweight as well as who are for overweight. So that anti-stigma piece is incredibly important. So it feels like we've got a lot of the right areas starting to come to fruition in the Healthy Weight Alliance, but as you say, going into the next year, having some more tangible actions that we can then highlight that we've made progress on next year will be really positive. So thank you, David.
Thank you. Any more questions? Yes.
I think the discussion around relationships with food and exercise and how we view that and how the public view that is one that needs to be explored much deeper than I think we currently do. As you can see by the data and things that we have, as has been stressed, those from a less advantaged background tend to be the ones that are more overweight than those who are in a more privileged background. That's completely shifted from what you would have seen 100 years ago, when those who were better off financially would have been slightly bigger. Those who were really, really struggling would have been much slimmer, struggling to buy food. It's completely different now. Those tables have completely turned. But when you look at that relationship that people have with food, I think that's probably one of the most concerning things that we need to look at. Why do they have that relationship with food and exercise? And why are they making the choices that they're making? You often hear people say, well, you know, the pack of 4 chocolate bars is £1.50, but the punnet of strawberries is £3.50. Correct. But the bag of apples is 69 pence. That's a choice that you had there to make. Why is that relationship with food completely different? What is it that's driving them to go, I'll pick the chocolate bars and not the apples, even though the chocolate bars are more expensive than the apples, but significantly cheaper than £3.50 for some strawberries? Why do you pick the bag of frozen chips at £2.20 instead of the bag of potatoes at £1? What is that relationship? What are they doing with that food? Is it convenience? Is it time? Is it... I know a lot of children with autism struggle very, very badly to eat different sorts of foods with different textures. They like the same thing. So what is that relationship? Is it having it in your face? Is it knowing what the calories are, or moreover knowing what the damage is of continuously eating like that and not having that exercise to balance it off? You can eat absolute rubbish food and still be underweight because you're just not eating enough. Some people eat lots of food, lots of bad food, and they don't seem to put weight on until it hits them later on, and that's something we often see in males in my work. The relationship that people have with diet and exercise is really important. One of the things that I noticed, which I thought was fantastic, at the coffee cart, you go to buy your coffee, you're at the desk, and there's a bowl of fruit immediately in front of you. You've got that choice hitting you in the face. Do I take the chocolate bar that's to my left, or do I take that fruit that's right in front of me? And that's probably going to be exactly as you said. If that's right in front of your face when you're at the kiosk or you're at the till, you're probably more likely to take that choice of, I'll have that apple, especially when it's cheaper than the £1 chocolate bar. But that relationship with food and exercise is very important to look into and see why we have the patterns that we have that are changing. Thank you.
Okay. Thank you very much. So I was just captivated by your answer, place-based approach in response to Graham's question. And you alluded to that we should be discussing with local partners, local businesses, so that they can modify their behavior. Is that the maximum we could do as a county? Like, can we not legislate? I'm just asking. On top of, put a rule or something like that, on top of what the national law says? Is it too much, or are we crossing the boundary?
We've got opportunities through the local plan to have supplementary guidance. So based on the evidence of health impact, there is an opportunity. So we have the hot food takeaway, for example, as a supplementary guidance that's within a certain parameter of schools. Right. We can restrict the number of takeaways that come in. It becomes a lot more complicated when it's convenience stores and such like. But there's always opportunities back to the relationship piece. And actually, a lot of organisations have got a social value responsibility into their local area that they are potentially more likely to come forward, but it's more on a moral basis of a company's ethic and ethos as opposed to the legislative requirements of them. So in some areas, such as the Co-op or Morrison's or whoever, we can have dialogue with, and that's again an intention for us going forward to have more relationship conversations with some of our outlets.
Yeah, so that's the maximum we could do. Given the circumstances,
we've got certain legislation opportunities, as you saw at the beginning of the presentation, around the sugar content, for example. So it's trying to influence industry at a national level, which is obviously the role of national government.
Yeah. Thank you. Anything else? Thank you very much, David. So let's move on to the last item. I think it's Jill will be leading it. Councillor Chicken would be introducing this item. Health and Wellbeing Board Forward Planning. Yes, please.
If it's all right, Chair, I think I'll just go straight into the report because it's quite straightforward.
Okay. Right. That's good. Yeah, it's your item, isn't it? Yes.
Yeah. This won't take too long, and then it is about opening up for conversation. You've had a report, and you've also had the slides. We were just pondering, Graham and Paul and myself, after the last couple of board meetings around, bearing in mind we've just had the closure report of the inequalities plan. We've got a refreshed joint health and wellbeing strategy, and we've got 2 years left of that. How do we better work with everyone in relation to reporting out on the progress that we're making? Oh, do I keep pressing the wrong button? There we go. So the purpose of the conversation is twofold. First of all, to look at how we currently do the reporting and monitoring, and also an ask of board members to see whether or not people will be prepared to undertake further questions when we present reports into board. Just as a reminder, I'm sure you're all very familiar with the current strategy. It has got the 3 themes of starting and growing up well, building blocks for a good life, and adopting a whole system approach. We've also got the 4th and underpinning theme of empowering people and communities as well. Now, what we've been doing up until now is undertaking an annual report based on each of these themes and presenting it back into board. And there's been an awful lot of time and effort spent from the public health team to coordinate that, and then to make sure we've got good quality feedback from our colleagues. But it doesn't necessarily feel like it is bringing it to life on a month-by-month basis when we come into Health and Wellbeing Board. So what we would like to consider is replacing that by looking at, for the next and remaining 2 years of the plan, how we have a forward plan that enables us to bring reports forward that very much look at the priorities, the commitments, the actions right up against the strategy, so that over the period of the coming 2 years, we can, by the end of it, very much be assured or not that we've worked towards the key actions that we've put in place. The other bit that reflected on and want feedback on is I've personally found the closed development sessions a real positive addition for us as a board, because it gives us more time to have an in-depth conversation at that development stage rather than just receiving a report and then opening up for conversation. So again, if people are keen to do so, we can factor in more of the closed development conversations over the coming 2 years. And ideally, this will start to reduce the amount of duplication that we have when we then have other annual reports coming in, such as the annual tobacco report or annual Healthy Weight Alliance report that we've just had today. And the big shift for me would be to have more of the partners up on here presenting back around, well, what are you doing in relation to working towards the Joint Health and Wellbeing strategy? So what we'd like to suggest is that we have 3 questions that are always considered when any report comes into board, and also for Chair and Vice Chair to challenge against these 3 questions as well if they aren't coming out as much as we would hope. And that's about how does the work that we're doing and sharing link directly back to the Joint Health and Wellbeing strategy, the priority areas and the monitoring indicators at the end. How does it help us address the health and social inequalities? Again, this is about keeping it in the forefront of our thoughts around that tackling inequalities lens. But we know the 4 domains of inequality. This is about geographical inequality. It's about protected characteristics. It's about the social inclusion groups. So it's just trying to think about the broadest sense of tackling inequalities. And then also thinking about we're a partnership at the end of the day. So how is this of reflective importance around all Health and Wellbeing Board members? So how do we draw that out and ask more questions of ourselves when we bring reports forward? We feel that the benefits of that would be ideally a much more structured approach to our forward plan, which we will then co-create, inform the gaps that we've got as we're working towards the refresh of a new strategy as well, because in about 18 months' time we will have to start writing our new health and wellbeing strategy. We'll have more shared accountability and more mutual engagement, which would be a positive, and as I say, to keep that priority of inequalities at the forefront of everything that we do. So if we want to agree this way forward, we have a fantastic policy officer, Andrew Dawson, who will work with Andrea on the development of the forward plan. We'll identify authors so people have got plenty time to come forward, so that there will be on that annual plan, ideally, an update from the police, an update from fire, an update from Health Watch, to make sure everyone has a rotational opportunity. And we will support and provide the guidance out to the authors to make sure they're aware of those 3 questions and the timescales to be able to bring it into board, so that everyone has got the papers in advance as we do now. And as always, we can take stock and review this to see whether or not it's working in 6 to 9 months' time. So that's the proposal that I just wanted to open up for board's consideration. Thank you, Chair.
Any suggestions or remarks? Yes, Abby, yes.
Just that I welcome that entirely, Jill, and it goes along with what we've been saying, and in terms of what I said before about having a voluntary sector and health network which can look at that forward plan and make sure that at the topics that you're discussing, the relevant voluntary sector partners can also come to either talk about their organisation or at least to be able to reflect and talk about the thing that's being promoted.
Yeah.
So it's really helpful for me. Thank you.
Yeah. I think that the third bulletin particularly impressed me because sometimes we don't know. We know the report is coming, but we don't know the authors. So we would like to interact with the authors to remind them, look, these are the expected things. Can you please tune the reports towards that one? So I think it's overall very good recommendations, essential, necessary, and I'm not sure whether it is sufficient. That's why I'm asking the board members if they have any other views on that one. So therefore, shall we agree on the recommendations for the time being? Because we are going to revise it if we hit a stumbling block in 6 to 9 months, so we should go forward. So Jill, does it take effect immediately? Is that the official version?
Yes, we'll be in touch for who's up next.
So there is the next agenda item is health and well-being forward plan. Please note the forward plan, and then please also take into account of what we have just agreed on as a recommendation.
So Andrew, just to confirm, Andrew will be in contact with everyone just to look at what's a relevant timeline for you to be able to do a report from your organisational perspective into Health and Wellbeing Board. So
yes, yeah, I think thank you very much for your team for having raised this and then building in. Yeah, please.
And I'm just imagining how that might work actually in the real world. So actually, when you come with a report, what I would love to hear is actually what are the challenges for the other partners in the room about how you can enhance the bit of the partnership working within what you're trying to do around it. So what I would hate to happen is we get some slides and it's the report done and it doesn't generate the discussion in the room that we really want. And that's it. It was trying to make sure, I think, with having new partners in here, so it's the relationships need to be formed by talking to each other about what we're all trying to do, and that was hence the development session, but also that the papers were to bring us to life a little bit and make the meetings feel like that we were achieving some stuff. And it's not just about reporting and justifying. That's not what the board is about. It's to make it alive. Yeah.
Yes, make it alive. That's a key word. Yes. So thank you very much for your team. In fact, and those people who are going to carry this out. It's essentially an important one. So there is no urgent business. So therefore, I'll just remind you of the date and time of next meeting. So the next meeting will be on 12th March, same day, same date, but next month, 10 a.m. And I think there's going to be a closed development session. Would you like to say a few words?
We've got a short open session to bring the Director of Public Health annual report, and then we'll be closing to do the focus work on the best start in life as our final deep dive area.
Yes, so both will be in the County Hall. Yes. So thank you very much for your attendance and contributions this morning. And I wish you all a nice weekend, nice day. Thank you.
Thanks, Paul.
All right.